Hello, I'm Mint. I'm going to be your nurse practitioner today. Nice to meet you. How are you doing? Good. So it looks like today I have you down for a routine pelvic exam. Is that correct? Okay. Can you confirm your full name and date of birth for me? Good. That all checks out. So I'm going to start by getting your vitals. So I'm going to take a listen to your heart and breathing. Get my stethoscope on. So I'm going to start by listening to your heart, so just breathe normally, okay? Good, and now I'm going to listen to your breathing, so take a few deep breaths for me. And deep breath in. And out. Good, and deep breath in. And out. Good. Deep breath in. And out. Good, and again. Good. Okay, now just breathe normally. Good. Okay. Your lungs and heart sound really good. Put this down. I'm going to take a look at your eyes, so just look forward at me. And just keep your eyes straight ahead. Thank you. Good job. Good. Good job. And then if you could follow the light with your eyes, but don't move your head. Good. And now I want you to follow the top part of my pen light with your eyes as it comes close to your face, okay? Good. And again. Good. One more time. Really good. All right, so before we get into the examination today, we're going to do a pelvic exam. Are you okay with that? Fully prepared? Perfect. I'm going to ask you a few questions. So I have them down right here, so if I'm looking down, I'm checking my pad to make sure I got everything covered, okay? So, how many times a day are you urinating? So how many times you're going to the bathroom to pee? Okay. And each of those times, do you feel like you're fully emptying your bladder? You don't finish up and feel like you still need to go? You could still go pee? Okay, good. Have you had any pain in your lower abdomen, your lower back, or in your pelvic region at all? Okay, good to know. Let's see. Have you had any changes in your medications? Okay. And how many times a day do you take that? And that's just an over-the-counter, like, vitamin? Okay, gotcha. Have you had any surgeries that we don't have on your chart? Yeah, no, you haven't been seen by me yet, so I just want to make sure that this is a complete medical history that I have of you. Okay, good to know. Have you had any trauma or injuries to your pelvic region at all? And when was that? Okay. And did you get seen by a doctor? Did you have to go to the ER at all? Or was it just something you treated at home? It was pretty minor. Okay. Are you circumcised? Okay. Are you currently sexually active? Mm-hmm. And are you using protection, so condoms? Okay. How many partners are you currently having or had, say, in the last 6 months? Okay, and are they female, male, both? Alright. Have you noticed any pain during urination or itching or a burning sensation at all? Okay. Yeah, I apologize about that. The air kicks on. Otherwise, it starts getting so cold in here. I will freeze to death, trust me. When I'm out in my little cubicle area, I have a heated blanket because it just gets so cold in the office. I hope you're not too chilly. Okay, good. Let's see, next question. Have you noticed any issues recently with, say, constipation? No? Okay. And how about the flip side? Anything with diarrhea? No. How often are your bowel movements? Okay. And do you strain usually, or do you have a pretty easy time going? Okay, good. Have you noticed any lumps or bumps on your penis or testicles at all? Any redness or rashes, irritation on, the same area? Okay, good. Have you noticed any abnormal discharge coming from your penis? Okay. All right. Have you had any fevers recently? Okay. And any other changes in your health? Anything you'd like me to know? Okay. And do you have any concerns that you wanted looked into today? Anything that I didn't go over? Okay, well then perfect. So next we're going to move into the exam portion. So I will step out and you will get changed into a gown. You can leave your shirt on, but please remove your pants and underwear. And I'm going to begin with doing some palpations on your abdomen and just seeing if there's any painful areas there at all. And then we'll move on. We'll do a visual examination of the penis as well as palpating it. Okay? Yeah. And if you're not comfortable with me, we will have male staff available if you would prefer that. And for this next portion, there will be someone accompanying me, so don't worry, they'll just be in the corner. Yeah, they just kind of hang out as a third person observer, just to make sure for both of our safeties. Okay, and this is a totally routine exam, so I'm not expecting to find anything crazy in there, so there's no indications from either you or your health history that we would be finding anything crazy. Any, say, signs of testicular cancer is one of the big things that we look for. And it sounds like you are very proactive with your sexual health, so that's also very important. We just want to make sure that if anything were to change, then we would know it and be able to find it easily and quickly. Yeah, preventative care is very important, so that's why it's very important for you to come in to get these routine checks, as well as knowing your body and what is normal for you and your body. So when things start to change, you can come in and we can figure out what's going on. And I know you've had this procedure before, so it's totally okay if an erection were to occur. We can stop for whatever reason whatsoever. If you're feeling uncomfortable for any reason, we can completely stop the exam and go from there. Okay. Well, if you have no other questions for me, I am going to go step out, and then me and my colleague will come in and we will get to the examination. Okay. I'll let you get changed. Can I come in? All right. Good. See that you're all in the gown. You can just take a seat up there on the examination table. I am going to apply some hand sanitizer real quick. Get gloved up, and we will get to the examination. The gloves can just be so tricky sometimes. It's insane just how much the fingers just get inside out on them, and then it's such a pain to get them on. I know, you'd think we would have found an easier way by now. Okay, let me grab the light again. So what I'm going to do is just have you move the gown up to your mid-stomach area, okay? And I'm going to start with just observing the tissues, making sure I don't see any areas of irritation, redness, rash, any signs of an STD, so things like that. You know, herpes kind of presents itself as a sort of not quite a pimply-like area, but definitely very bumpy, irritated, and they can blister. Blister's the word I was looking for. Okay, so I'm going to start with the visual examination. I'm just going to be looking, and again, if you ever need to take a moment, just take a breather. We can totally do that. Just let me know, and we will stop. Or if you've had too much, then we can completely stop the procedure as well, okay? So if you're ready, I'm going to begin the visual examination. Everything looks good. Don't see any area. Do you go to a dermatologist? Okay. And they've looked over the moles that you have there on your stomach? Okay, good. 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 Okay. Everything is looking good. Tissue is looking healthy so far. Now I'm going to observe your testicles, so your scrotum. So I'm going to ask you to move your penis up and out of the way, just towards your stomach for me. Thank you. Okay, good. Everything's looking good. And then if you could kind of move your testicles up too. Just have to check around the rectum as well. Their tissue looks healthy. All right. Now I'm going to move into the palpation. So I'm going to start on your lower abdomen. And if anything feels painful at all, please let me know. So I'm now going to put my hands on your stomach. Are you all right? Okay. Here we go. Good. Good. Any pain there? Okay. Good. Good. And how about right there? Okay. Good. 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 Any pain there? Pressure? It's all right? Okay. Okay, lower abdomen is looking good. And you don't have any pain on your back at all, lower back? Okay. Yeah, I just need to make sure that there's no pain in the kidney area. All right, so now I'm going to be moving down to examining your penis. So I will be doing palpations again, and I'll just use my thumb and these two fingers to... First, I'm going to start from the base, moving towards the head, and I'll be from top and bottom, okay? And again, just feeling for any areas of lumps, bumps. It should feel like a pretty spongy organ, normally. Okay. There shouldn't be any areas that are too firm or any divots in tissues. Here we go. Still doing all right? Okay, good. All right. When we get to the head, I'll just open up to look down your urethra and make sure I don't see any signs of any discharge. Everything's looking good. Okay, and now I'm going to begin again on the sides. And we will just move down. Okay, all of those tissues feel good. Now we are going to get your penis out of the way. Over the next portion, we are going to be looking at your testicles. We are going to examine them again for feel. They should feel like a rather spongy, rubbery consistency. There shouldn't be any areas of bumps or firmness. And then I'm also going to check you for the volume of each testicle, just to make sure it's within our normal range for your age. Yes, so like smaller or larger could be indicative of other health concerns that we would have for you. Okay, so ready to begin? Okay, perfect. And then I'm going to start by feeling this testicle, and I'm going to take my oxidometer beads, and we're going to compare the volume of each testy. Okay. Let's see. There we go. Okay, good. Good. Yep, that is well within normal limits for your age. And now I'm going to feel around testicle, just making sure everything is feeling normal. Good. And I'm just going to feel behind for the vas deferens. That's just the tube that your seminal fluid will travel through. That feels good. Okay, and then we're going to move to the other testicle over here. I'm going to feel this testicle and judge it against the beads that I have. And again, this side is well within normal limits. Perfect. And now I'm going to palpate over here to feel the tissues again. Okay. You're doing really good. Are you still doing all right? Okay, good. Okay, everything is feeling really normal there. So now I'm going to do a hernia check. So I'm going to have you turn your head away from me and cough when I tell you to do so, okay? So we're going to check this side first. Let me just get into position. Good, and if you could just turn your head away from me and cough. And again. And one more time. Thank you. Now let me get into position. And the other side. Okay. Good, and then turn your head away again. And cough. And cough. And one last time. Good job. Okay. All of your tissues look good. Get these gloves off. And you can put the gown back down. We are all done with your examination, and everything is looking really good. If you have any other questions for me, if not, me and my associate will step out, you can get dressed, and then you're free to go. Yeah, quick and easy. I know, I think people get it really worked up in their head, so I try to make things as fast as possible, as informative as I can be. But we are so glad to have you today. Thank you for coming in for your routine checkup. Just make sure that you're doing your self-checks in between each routine check as well, just like I said, so you are aware of any changes in your body so that we can catch those things as quickly as possible. Well, it was lovely getting to meet you today. I hope you have a good rest of your day, and the gals up front will help you do everything you need to check out. All right, we'll see you around. Bye-bye.